What is eczema? Eczema is a common skin disease that we see in our clinic. It's actually an inflammation of the skin, of the top layer of the skin. And what is inflammation? Inflammation is just like a wall at the top layer of the skin, whereby the skin sends lots of inflammatory cells to the top layer of the skin, and as a result, it becomes itchy, red, and initial stage, we call it acute eczema, is weepy. And after that, the subacute or the chronic stage, it becomes dry and scaly. If you can look here, this is the top layer of the skin we call epidermis. And there are a lot of inflammation over here. And as a result, there's a lot of water collection around here. And where does the water go? It goes out. And you will form a blister on top of the skin. If the blister happens on the palms and soles, then you will feel little bumps on the palms and soles. But whereas if it happens on other part of the skin, the top layer is very thin and it will just peel off. That's why the eczema can become weepy. A few weeks later, the skin will dry up and become what we call a subacute eczema. And the process can happen again and again, from acute eczema to subacute back to acute eczema, and eventually you become chronic eczema. You can see that the skin becomes very thick, very dry, and then you start to see wrinkles at the surface of the skin. It is important to let the patient or the parents know about the different looks of eczema, because eczema, as I mentioned earlier, can present as weepy eczema, or it can also present with dry and scaly eczema, so that the parents or the patients will not be afraid whether this is fungal infection or whether this is a different kind of diagnosis for this presentation. They are all eczemas. How many types of eczema? Eczema can be divided into exogenous eczema or endogenous eczema. Exo means outside, from outside. So exogenous eczema, for example, contact eczema, something that we are allergic to in contact with our skin and causing eczema. Endo means from inside, and most of the time it's associated with genetics, such as atopic eczema. And is there any difference between eczema and dermatitis? No, they are both the same, exactly the same. So how do we treat eczema? First is to get the right diagnosis of eczema, and followed by a right diagnosis of the type of eczema. And why do we need to differentiate different kind of eczema? First, counseling is different and the prognosis is different. For example, seborrheic eczema, most of the time it tends to have a very good prognosis and easy to treat. Whereas for this eczema like lichen simplex chronicus, which is a kind of very thick eczema, you need a more potent topical creams in order for it to work. You can't be using very mild cream for the thick eczema. So that's why we need to differentiate different kind of eczemas. How do we treat atopic dermatitis? Again, it has to be individualized. I will spend at least 20 minutes with my patient to discuss about the management of atopic dermatitis, because it has to be a co-management between me and the patient and the parents. And I'll simplify by telling them these 5 I's. The first I, which is inherited. The second I, inflammation. Third, itch. Fourth, infection. And the fifth, irritation. Let's talk about the first I, inherited. Inherited meaning it's genetic. I'll tell the patient atopic dermatitis is a genetic disease. And we know nowadays that there is a lack of a gene in the patient's skin. The function of the gene is to preserve moisture on the skin. When you lose that gene, or when you lack of that gene, you lose moisture on your skin. Therefore, we need to replenish the moisture on the skin. How do we replenish it? By using moisturizing bath gel, followed by moisturizers. And they should be putting on it for lifelong. Second I is inflammation. How do we treat inflammation? by topical steroids. There are many types of topical steroids, from very mild ones to very potent ones. So when do we use the mild one and when do you use the potent one? It depends on, first, the site. Where is the eczema? Secondly is the age of the patient. We rarely use moderate potency or super potent topical steroids in infancy or in children. But whereas for pumps and soles, you can use very potent one because the skin is thick. The only side effect of topical steroids is thinning of skin. Another type of topical treatment that can be used to reduce down inflammation is what we call topical calcineurin inhibitor. We use it as a proactive management, meaning even before the eczema happens or relapse, we have already started using it to prevent eczema from continuous recurrence. The third I will be itch. We know that when you itch, you scratch. And when you scratch, you itch even more. When you itch even more, you scratch even more. So the vicious cycle goes on and on and on. And we need to break this cycle by giving the patient antihistamine, which is harmless. The fourth I is infection. Patients with atopic eczema are more prone to getting infection, skin infection, such as bacterial infection, fungal infection, viral infection. So I tell my patient, if you notice that after applying the topical treatment, the skin disease is getting worse, please bring the patient to your nearest doctor, because we may need to start antibiotics, we may need to start antifungals, or sometimes even antivirus. The fifth I is irritation, meaning what can irritate the skin or what can trigger the eczema again. First is stress. I divide it into physical stress or psychological stress. Psychological meaning tension from family, from friends, or from relationship. Physical meaning if you lack of sleep, dehydration, you can also trigger the eczema. The second irritation or irritating factor would be sweat. Anyone, if the sweat remains on your skin for more than 1 hour, you start to get itchy, because sweat it can cause irritant contact dermatitis. Third thing is dust. We know dust has dust mites, and dust mites can trigger eczema again. So how do we reduce down dust mites? I'll tell my patient to open up the curtain early in the morning, open the window, let the sun come in. Change regularly the bed sheet. The mattress, if it's not too old, just dry under the hot sun. Try not to have pets, especially the furry pets. I know it's difficult. So if you have pets, bring regularly to vets to make sure that there are no mites on the pets, and try not to have any carpets at home. So these are the important factors to reduce down dust in your house. And other factors will be like water. A lot of people think that water makes the skin shiny, so when they have eczema dry, they'll put water on it. It looks shiny perhaps for 15 minutes, but later on it becomes dry and dry, because water washes away the moisture out of our skin. So I'll tell the patient not to bathe too long. If you bathe, just a short bath. And finally, everyone would definitely ask me, what about food? Because in Asian countries, we always talk about food. But actually, food is not an important factor that can trigger eczema. From all the studies, there's no strong evidence that food precipitates atopic eczema. Only a small percentage that can be triggered by certain food, but the percentage is very low. So I'll tell them, don't think too much about food, but rather concentrate more on moisturizing the skin and looking after the other 4 I's. The 5 I's is just a simplified way of managing atopic eczema, but the final management should be individualized according to the needs of the patient. My advice is seek professional help early in order to get the disease under control.